someone's asking if you can tell them if natural killer cells are rare. They're saying mine are high and have had 3 miscarriages and not sure what to do. I'm so sorry to hear that first.
Yeah, well, it's always a big debate whether that really is playing a role or not. Nobody knows for anything definitively sure that just because you've had, unfortunately 3 miscarriages and your killer cells are high, that's the cause of it. But if you've had a complete workup and, you've had PGT on your embryos, I mean, to the best of our ability, those are chromosomally normal ones you're implanting. You've had, your uterus looked at, that there's no, problems with polyps or fibroids or, endometritis or Asherman's, or something with the lining. You don't have a clotting problem. So all the tests for thrombophilias are negative. And the only things out, and maybe you have anti-thyroid antibodies. That's a clue that maybe you have autoimmune disease, or you have lupus, or you have some kind of elevated ANA. Maybe there is some kind of subclinical autoimmunity going on there. But I think that has to really kind of be looked at in the context of everything else. I don't think it would be the first thing we would look for, but in this situation, maybe it's worth treating you. Now the question is, what do you need? Depends. Most people would probably give you intralipids, I would think, because it's pretty cheap and easy and safe. But some people, where we really think this is immunologic, and there are some people out there where there definitely are immunologic losses, they require more heavy-duty things like IVIG and prednisone, things like that, and maybe even blood thinners. So it depends on the situation and what other constellation maybe of antibodies or other problems are going on there to decide what type of immune therapy you might need. So that really should be discussed with your practitioner. That's got to be, he's got to have an expertise in that too.
And sometimes we see coexisting natural killer cell elevation with blood clotting disorders. So I think that's important to get that checked as well and make sure.
Well, that's what I was saying, is that the thrombophilia is the panel that checks that. So that really should be checked. And most OBGYNs would check that right away. They're pretty familiar with that. So they a lot of times the patient comes to us, they've already had the clotting or the thrombophilia panels done, and it's all negative. But the natural killer cells, the important thing also to know is that sometimes if other doctors are sending out the natural killer cells, if they're looking for that kind of thing, it depends on where that lab gets sent. You got to really be very careful, because if it gets sent to Quest, it's useless.
Really? Okay.
Yeah, they're not real good with that. I mean, it has to go to immunology labs that specialize in this kind of thing. So, a lot of times it doesn't get covered by the insurance, which is a little bit of a tough thing to stomach sometimes, because you have to repeat those a few times, and they're not cheap.
And the treatment would be different based on the amount
Well, it depends. Again, depends on the scenario here.
Okay.
Depends on what we think really is going on here. And if we really think this is an autoimmune problem, sometimes you may want to go with the big guns. But sometimes the NK, the natural killer cell test, one of the tests you can get is to get an idea how well you suppress, with the different therapies. NK activity gives you the ability to sort of get an idea that, hey, you're going to suppress nicely with intralipids or IVIG or whatever it may be. So you have an idea that maybe things are going to work out pretty well. But, there's no guarantee that just because we treat you with all this, that implantation failure may or may occur, obviously, but it may not.
No.
So there are going to be some mysteries out there that we're going to not be able to necessarily figure out.